Hey everybody, it's Dr. Hammerstedt from Holist here for a Medical Monday. And so we are on an attempt to get one of our Holist friends, Dr. Ahmed, here to talk about pelvic pain and holistic treatments for taking care of those. And I am just going to fix this here. There we go. We've got our guest request up. And all right, so Medical Monday, it is Endometriosis month, and so endometriosis is a type of condition in women that causes chronic pelvic pain, but we're going to be talking about more than just that. We're going to be talking about how we can help people with pain relief in holistic ways, which is something that's really important to me. I'm really stoked to introduce you to Dr. Ahmed. She's a physiatrist. Oh, there she is. My goodness, that was quick. Physiatrist in New York City at the Pelvic Rehabilitation Medicine Clinic. She's a physical medicine. Hi.
Hi. How are you?
All right. I'm great. I'm going to finish introducing you a little bit, and then we will talk. Thanks for joining me. So a physical medicine rehabilitation physician, I'm just telling our communities here who may not know what that is a physician who can specialize in many different types of rehab. And for you, you specialize in a whole body treatment of chronic pelvic pain in men and women with both invasive and non-invasive treatments. And I love that because you know that here at Holist, we're curating a movement towards team-based, proactive health and wellness. And so you're right up our alley. And so I love talking to other doctor moms about interesting, amazing things you guys that we're all doing to empower our lives and help our families and help our communities of patients in different ways. And I'm really excited to hear from you about how you guys there take care of patients who've really fallen through the cracks of other specialists and work with acupuncture, yoga, meditation, diet, physical therapy for adjuncts for care. And so really welcome and thank you for joining me from New York City.
I'm excited to talk to you.
Good. So first, tell me what how you define pelvic pain and what your patients have been through before they finally get to you.
So pelvic pain is basically, well, I treat chronic pelvic pain, so most of these patients have had it for more than 6 months. Basically any pain in the region below the knees, below the belly button or above the knees. As a PM&R doctor, I'm trained to work on the muscles, the joints, and the nerves since I don't really have an organ system. Most of these patients have gone to GYNs, urology, urogyns, GI doctors. I'm kind of doing the runaround for a couple of years. Sometimes it's 2 years, sometimes it's 3, sometimes it's 10, sometimes it's 15, sometimes it's 1 week. I mean, it's amazing when we see someone who's only had pain for about a week. But usually if we address the pelvic floor, a lot of the symptoms that they're having that are urinary or GI or sexual can actually get treated and start improving.
Wow. So there must be a lot, and I'm sure you'll talk about this, but a lot of emotional, issues going on with not just the pain, but just the process of trying to get through the health system in a situation like this.
Yeah, there's a lot of anger and frustration that patients have because they're really trying to deal with a very specific and sensitive topic. It takes them a long time to finally talk to people about it. And then when they finally do start talking to someone about it, now they're wondering why is it taking so long for them to have a diagnosis? But I mean, doctors aren't perfect. We definitely don't know everything about every field. And a lot of urologists, GIs, GYNs, they don't really even know much about the pelvic floor. Some do, and we definitely work with a handful of specialists in New York City that we love and help us with our patients. But people get very anxious, and then can you imagine you're sitting here thinking about your pain, and now you're going in this cycle of just worried and anxious and depressed, and now pain, and then you're depressed about your pain, and now you're depressed that you're, you can't have intercourse, you're having painful bowel movements, you're having urinary issues, and you're waking up in the middle of the night, so you're not sleeping.
It'd be hard to do anything. Yeah,
yeah.
For sure. Can you explain to our viewers kind of what the pelvic floor is and sort of how it's innervated and how those different innervation systems sort of help you decide which treatments that you're going to use for people?
Well, I actually
yes.
Um, so basically, the pelvic floor is a hammock that holds up the bowel, the bladder, and the prostate in males and uterus in females. And it's a set of muscles. And so when all of the organ systems, they go through those muscles. And so, the nerves that innervate, so this is the male, and then in female, it's actually like this. There's a couple major nerves. There is the pudendal nerve, there is the posterior femoral cutaneous nerve, the genitofemoral nerve, which innervates part of the genitals. Then there's the ilioinguinal nerve. So there's a bunch of nerves in there, and depending on where patients present with pain, that's how we decide what we're going to address. But most of the time, we kind of look at the patient like a 360 approach. They're having pain in their, pain with sitting. Or are they having pain just with intercourse? Or is it just after intercourse or masturbation? Sometimes patients have more sexual side effects, and sometimes they're more GI versus urinary. So we kind of address what the issue is specifically with them. Yeah. And with every patient, we make sure they have a proper GI or uro workup. We definitely don't want to miss something bigger, like cancers, and that's kind of or if there's something actually GI going on, then no matter what we do, it's not going to help.
Right. So at Holist here, we're working with clients mostly with unprocessed whole foods for healthy, low carb, healthy fats, for weight wellness and for health wellness. And so we're really big into real food. And one of the things that I really liked about what you were talking about earlier was sort of about how you can use diet to help improve some of these. You've mentioned specifically endometriosis, which is obviously our pelvic floor issue or pelvic issue of the month, yeah. And painful bladder syndrome. Can you talk to me about sort of how that food affects the metabolics or
yeah, so estrogen is, endometriosis is very estrogen driven. So there are different types of foods that, help you metabolize the estrogens and decrease it in your body. There's something called diindomethylene, which is something that you can naturally find in Brussels sprouts, cauliflower, broccoli. Not that everyone loves to eat that type of stuff because it can make you gassy too. But yeah. They do sell supplements at Whole Foods for diindomethylene. Other type of diets to consider is obviously sugars. So anything that, sometimes there are chemicals that can mimic estrogen, and that can cause an increase in the pain. So endometriosis is having having pain when you have your period or not with your period, but it's typically estrogen or progesterone driven. And so, for those type of patients, if you're having any increase in estrogen, that could cause more pain. And so the theory is to bring those hormones down, and the pain should resolve.
Hey, when we're done with this, if you could put a link in the comments just to what the name of that is and the supplements that people can look into, as well as a couple suggestions on that I'm sure people would really like to look at that. Thanks.
Happy to do that.
So also here at Holist, I'm working on building, networks of practitioners and doctors who want to work together for this proactive health and wellness services. And so I'm really interested in you kind of talking about yoga, meditation, acupuncture, working in concert to really reach your patients' goals. And so your clinic's approach really sounds awesome. I'm just sort of wondering if you could tell me about, how that looks like for you and for the patient, and integrating those services together to kind of create that team.
So typically when you're dealing with someone with chronic pain, it's a bit of a pathway. It's not just a simple, why is it chronic,
Right.
When they have
someone else would have figured it out by then if it was that simple.
there is usually a mechanical change, and that mechanical change tends to lead to some sort of muscle spasm in the pelvic floor or elsewhere. And this you can call this about any part of your body. There's going to be that decreased circulation, weakness, and then peripheral nerve irritation. Now that's focusing on the peripheral nerves, but what about the central nervous system? And so different things to act on the central nervous system and decrease the pain is, things like yoga and meditation. Yoga actually is good because it also improves the blood flow. So when patients are just spending all their day sitting and standing and lying down, and they're not getting a lot of that movement that they would if, partially because they're in pain, so they don't want to move. But when they are physically getting into positions that may improve that blood flow, now, the blood is flowing, circulation's improving, the muscles are not going to be as weak as they were before. But also there is that mind and body when you're doing yoga, and getting into that and understanding that, okay, this is my time where I'm not going to be thinking about my pain and I'm not going to be focused on it.
Right. I mean, I'm just thinking about, learning to value yourself in someone who's struggling with this, but also, breathing and improving the ability to kind of use our abdominal, and I'm sure the pelvis,
the pelvic floor, and breathing, and a lot of people are breathing the wrong way and so there is belly breathing and different.
Sorry, I have an ambulance coming. Hold on a second. I warned people that this was going to happen.
Okay.
So that's great. So and then the other, also thinking too that just becoming active improves your mood, which, as we talked about before, really can help. So do you do all of this in your office? Like, do you have acupuncturists, yoga, meditation?
We don't. So we're just 3 physicians, and we're just trying to. We spend about an hour and 15, an hour and 20 with each patient first time they come in.
That's so awesome.
So we really don't have the resources in New York City. Rent is quite expensive, so we don't have the space or the resources to have everyone in here. But we definitely have places to refer to. We work with amazing physical therapists in New York City. We can recommend some pelvic acupuncturists who do acupuncture towards the pelvic floor. We also have some movement specialists that we work with in the city. And most of the time people are we also recommend yoga with Adrian. It's on YouTube. There's a link from our website. So we have to give them some free options too, so that they can do that. And then, in terms of meditation, we usually tell them to download an app like Headspace, or even just to do something that they love to do that can kind of get their mind off of things. I tell people you can color, you can pray, you can sing, whatever it is that makes you feel good and doesn't. For me, if I could get a nap in, I consider that meditation. Because I am not thinking about my patients, and I'm falling asleep.
Well, I don't know if us doctor mamas get a lot of naps, but it does sound really nice.
I that was my New Year's resolution, and it's really only happened a couple times, but
well, that's great. So it was really great talking to you. Let me know, and our viewers know, how they can follow you on social media and how they can find you in person for pelvic floor issues, because I think you guys see people from all around the country. Please, give us some information about how we can find you.
Yeah, perfect. I will. I'll definitely post about it. We are pelvicrehabilitation.com is our website. Dr. Ahmed is my Instagram handle, and Dr. Ahmed, pelvic pain specialist, is my Facebook handle.
Perfect. Awesome. Great. So please do put links in the comments and any interesting reading that you think that anyone might want to look up. And then, as always, for our viewers, you can find Holist at www.holisthealth.com, and my handle on all social media is @holisthealth. And you can join us for weight wellness coaching programs. That's a 12-week program where we concentrate on mindset and metacognition around whole foods, and also working on, again, building networks, kind of curating practitioners like yourself to work together to take care of people. So have a lovely Medical Monday, and thanks for all you do for these these patients who really need you guys. So thanks a lot.
Thanks for having me, Dr. Hammerstadt. Take care.
Take care.